Okay. Okay, good morning, everyone. Can everyone hear me? Nod of the head. Okay,
Yes.
thank you. All right, if you didn't hear the opening, today is Tuesday, October the 13th, 2020, and it's 9:02 a.m. this morning. Proof of posting, please.
The agenda was posted on Monday, October 12th, 2020 at 1:30 p.m.
Okay, thank you. Let's pause briefly for a moment of silence, and then we'll have the pledge to the flag. Thank you. Please join me in the pledge. I pledge allegiance to the flag, nation of America, and to the republic for which it stands, one nation, under God, with liberty and justice for all. Pledge to the Texas flag. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you. We do not have any public comments. First of all, I want to thank the commissioners for agreeing to join us this morning to discuss the governor's order that gives option to the county judges to opt in or opt out to allow bars to operate under specific protocols. And in this, we will look at some information and have it's no need to have a vote on it, but I would like to have each commissioner's opinion. I value your opinion. And so as we move forward to try to address these COVID-19 issues as they come up, and that we'll have a good solid basis and reasoning behind everything that we do. Additionally, we will have some presentations on the status of what the coronavirus situation is specifically in our county as well as in the common service area M. And the reason we can call this court, this emergency meeting under the fact that it's we have issues beforehand that we need to act on. One being the discussion about the order, looking at the information. And later on agenda item is the look at the option to go into a contract with a third-party vendor to help us access CARES funding as well. And so this we have a timeline on it that's narrowed quite a bit. So once the court, that will be an action item the court would act on. Okay, first I would like to go under item Z, consideration or action, the following items in discussion or action matters regarding COVID-19, including but not limited to staffing emergency operations, what the current situation is, and then the testing efforts that are going on. So I'd like to call on Elizabeth Thomas for an update.
All right. Good morning, everyone.
Morning.
All right, I'll start off with the numbers and then I'll go into our testing numbers. As of yesterday, 39 new cases of COVID-19 were confirmed. In addition to those 39 new cases reported, there were 27 cases which were not reported due to technology issues from a reporting entity on Sunday. These 20 cases are included in the total number of cases to date. The total number, including those undercounted cases from yesterday, is 9,029. There are 464 estimated active cases and 8,438 estimated cases that have recovered. 54 cases are hospitalized. Out of those 54, 45 are McLennan County residents, 16 are on ventilators, and we have recorded an additional 2 deaths in McLennan County, bringing the total to 127 deaths.
Okay, thank you.
Mhm.
Are there any questions for Elizabeth? Okay, thank you. Under item E2, discussion or consideration action.
Judge, did you want her to get into the testing numbers?
Yeah.
Yeah, yes. Were you going to go over the testing numbers?
Yes, sir. That's what I was getting ready to do. So our testing numbers, as of last Wednesday, we had started our surge testing here in McLennan County. From last Wednesday to yesterday, we have completed a cumulative total of 2,223 tests. Those are split between our sites at Waco ISD Stadium, McLennan County Community College, the Waco Convention Center, and then the Waco Hispanic Chamber of Commerce just started yesterday. And we're looking forward to seeing those sites continue forward, continue to test more people, as many as possible, and looking at future sites as we build out and figuring out where we need to target for our community.
Okay, and there is additional efforts putting media information out to encourage more testing in all the populations in McLennan County.
Yes, sir. We're really trying to push the message that the nasal swab is not the full nasal pharyngeal swab. We want to make sure that people are comfortable with that message. And then we encourage people to go get tested if you have any sort of concerns, or if you need to visit maybe a relative in the nursing home. Please take advantage of the testing that we have and make sure it's available to the public, and we want to make sure we meet everyone's needs.
Okay.
Elizabeth, are we seeing results yet from the first surge tests, or are we still in that time period where we're not seeing results yet?
There are people who have received their results, Commissioner Perry.
Okay.
Yes, sir.
Okay, any questions for Elizabeth? Okay, thank you, Elizabeth. Under E2, a discussion and consideration potential action on option to allow bar openings by the governor's executive order GA-32 and related TABC attestation forms. So what we've done here is besides the report that Elizabeth and her organization provides, we have asked other presenters to talk about what the situation is in McLennan County, and then us to be able to ask questions if it's if we deem that necessary. So Dustin, I'll let you kind of open up the discussion in regards to current numbers and
Okay, will do. Judge, on the call, we have Dr. Farley Werner, who is our local health authority and an infectious disease specialist. He has a PowerPoint with a few slides that he would like to be able to share with the court, if that is okay.
yes.
Dr. Werner, would you like me to, I have those. Do you want me to share the screen and you step through them? Dr. Werner, you're on mute.
Yes, will you be able to advance the slides? Because
Yes, sir. I'll do this.
Okay. In looking at this issue, we're talking about person-to-person spread and the risk associated with specific activity. And there are 2 factors that measure into deciding what the risk is for anything we do. And the first is since the spread is when we interact with people, the question is, what's the chance that the people we're going to interact with have COVID-19 at the time? That has to do with how much COVID is in the community. And the other factor is is that particular activity, what's the likelihood that that's going to be a situation that transmits the virus from person to person? So if we look at what's happening in our community, what you see there is the curve of the number of new cases per day in the county starting back in May. And then the first big bump is our surge that we had from June into July. And after that, we brought down, or the number of new cases per day came down. But what it's done then over the last 2 months is level off at an activity level that is too high. We're happy that it's not where it was, but it's too high. We're seeing still a continued new cases per day count that ranges in the 50 to 60 something range. You look at the next slide. This is for comparison, Harris County, and looking off to the left, it's cut off, but their pre-surge level was what now looks like their post-surge level. And they had a great deal of activity for a time period. And then when they came down to very low levels. Surprising accomplishment for a county of 4.7 million people, where you'd expect the ability to control community spread would be even more difficult. Next slide. That is, I think that's all, that may be, I think that's the state numbers as far as new cases per day. And from the standpoint of the state, it's leveled off at a level that's actually lower than this county. And looking at the next slide, just for information, this is the age distribution in the county of our cases, with a peak as expected in the 18 to 25-year-olds, and then decreasing as you get to extremes of age on either side. I think one more slide. So what we're doing here is assessing that community risk, what the community activity is. And if you want to compare community to community or county to county, you can't just look at how many new cases per day you have. You have to compare that to the population. So these are the numbers of new cases per day per 100,000 in that population listed for several counties. And those are for the last 7 to 14 days moving average of new cases per day. And you can see that other counties after their surge have brought down their number of new cases per day. That's enviably low. And for Texas as a whole, because of hotspots of continued activity, the new case per day per 100,000 Texans is at 14, and McLennan County sits at 25. We are in fact a hotspot. And what I'm saying there is that because of the degree of activity in the county, the chance that a particular group of people is going to have someone who's COVID positive is higher than in other areas. I think that's the last slide. The other factor is, what's the likelihood of when people are together that virus is going to be transmitted, and that has to do with what kind of interaction it is. If we're specifically speaking about bars, then in the traditional sense of a bar, that is the pretty much worst situation imaginable. It's a closed room, typically poor ventilation compared to other types of establishments. It's there for socialization. You're going to have people not wearing masks. You have an attempt at social distancing, which will be hard to enforce. And with the information we have about contribution of airborne transmission, the longer you're in a room with people not wearing masks, you also increase the likelihood of transmission, even if you are staying 6 feet apart. You put all that together, and you can say that reopening bars, even with proposed controls, is likely to be a factor that enhances community spread. To what degree, I certainly couldn't say. If I was asked whether we should have increased release the controls and go from 50 to 75% in restaurants, I would have said no, but I wasn't asked, and that comes from the governor's office. That's my opinion, and those are my reasons.
Dr. Varner, what do you think the difference is, or what were the difference? I think the protocols, let's just take Bell County. Harris County is kind of, like you said, it's over 4 million people. Bell County is kind of closer to our demographics and all those things. What do you think they did different than we have, that their numbers are quite a bit lower, like a third or so of our numbers? Do you have any idea or sense about what that might be?
Yeah, it's one of the harder things to try to tease out among it, because whether it's, I think the degree to which masks are accepted and consistently used has a great deal to do with it. Whether or not as a community we have a sense that things aren't going as bad as we thought, and that socializing in groups is something that we're just going to go ahead and do. I think that plays a big part in community transmission. As far as a difference between Bell County and here, I don't know that race and ethnicity differences are that great. We have a preponderance of cases in Hispanic population, but even if you corrected for that increase and that population had an incidence similar to others, that would likely only decrease our cases per 100,000 by 10 or 20%, which would still leave us at a very high level. Short answer to your question is, what should we do different? What can we do different in comparison to other counties? I don't have a good answer for you.
Okay.
Or we would be focusing on it.
Be doing it. And the surge testing that we're involved in now is going to be quite extensive, we hope, with the fact that the governor has allowed us to have up to 40,000 tests. How do you think that will impact these numbers?
So where the early results that we have back so far, very early, show a positive rate amongst those tested of about 5%. And the first ones of those will probably show up in today's case count.
Okay.
But what I don't know is amongst those, I think about 1,800 or so that we know the results of. Don't quote me on that number yet, but of the ones that we have results on, what we don't know until the case investigations are done is whether they had a test because they were symptomatic, or whether they were a close contact, or whether they were asymptomatic. If we can tease out the number of people who are asymptomatic and get tested and are positive, that gives us a good idea of again, of the activity in the community. If we get a lot of cooperation and a number of tests done, then that'll do two things. One is it'll allow us to identify cases, get them in isolation, identify contacts and quarantine. And each one of those that identified, we cut off the spread tree, so that can be beneficial in bringing down our future numbers. If we really test an extra 10,000, 20,000 people in the next 2 weeks, then transiently our case numbers are going to go up in reflection of that. But the idea is that as a result of that, in 4 weeks and 6 weeks, we won't be as high as we would have been if we hadn't captured them already.
Right. Plus catching people early can cut down the risk of hospitalizations, I would imagine, as well. Or
Yeah, so,
those people infecting their grandparents or older people that are more susceptible to bad.
yes. And our hospitalization rate mirrors our new case rate in that, the more cases we have, the more hospitalizations we have. And our hospitals are handling our current hospitalization rate, which is high. But what we don't need is additional stress on the system by an increase in cases in the community. And to what degree influence reopening bars is going to have on the total case count, that's something you can't put a number on. But again, my point is that anything that we do that would be expected to increase that number, if we can avoid it, all the better.
Okay, thank you. Dustin, are there others that want to speak to that from the city?
Judge, I see Ryan Holt on the line. I don't know if he wanted to say anything or not, but he is the only other one, I believe.
No, sir, we don't have anything to add on that. Thank you.
Okay. All right, are there any questions any of the commissioners would have for Dr. Werner or anyone else on the call?
I do. Dr. Werner, I'd like to ask a question. The way that we are reacting to increases in cases would lead one to believe that we have identified restaurants as the source of problems with the increased numbers in the county. And why I say that is the only industry that I'm aware of that's affected when we get over the 15% threshold for restaurants. Have we tied numbers back to the restaurants that clearly identify they are the problem? Or is it just the best guess of where to start trying to mitigate risk?
I don't believe that it's been tied directly, but it is the business that by its nature allows everybody that's going in there not to wear a mask. And that directly affects your risk of transmission. And all the other situations, people are supposed to be wearing masks. And but that's my understanding of the difference in why the restrictions would only apply to restaurants or bars.
And then a follow-up question that I have, and maybe if Ryan's still on the phone, do we have any data that would indicate that McLennan County residents are not taking the mask order as seriously as, say, Bell County or any other county that surrounds us? Do we have data that would show that we're not taking it seriously enough, or is that an assumption? And I'm not picking, I'm just understanding.
Yeah, no, it's a perfectly valid question and the answer to it is not that I know of, because that's it would be a metric very hard to quantify. How do you measure that? And so I'll make my short answer as no.
And just asking, because I'm frustrated as well that our numbers seem to, I'm happy with where they've come down to, but we would certainly like to see that continue to come down. So that's the reason I'm asking the questions, is try to.
Yeah.
Yes.
I know you're sitting there daily, sir, trying to figure out why, but thank you for your answer.
Yes.
One clarification, it's not just restaurants, it's businesses, retail, all of them that would affect, but it's the one that's more likely to have people there for extended period of time. But also retail businesses and office capacity and those things, people coming in, they're affected the percentage.
Well, you certainly don't see it.
Yeah.
In other areas.
Right.
And that's
Right.
Well, I just like to say, I was at a local park yesterday and there was a bunch of people playing basketball and huddled close together, and none had on masks. And I've been on to several sporting events and people are sitting side by side on the bleachers with no masks. So I think, it's not just the businesses, it's the relaxed activity in the evenings. You're getting a lot of contact.
Mhm.
No, I think the socialization side, whether it's, physical activity or just people getting together, is a big factor. And no, I don't want to blame it on businesses because I think that's just part of it. But the acceptance and use of masks in social settings carries over into their use in businesses, or at least in the workplace. You have establishments that have customers coming in and out and interacting with staff, and then you have workplaces where everybody goes to work and they wear their masks in the door, and then they don't wear masks inside. And even those that comply, you have issues like break rooms and where people eat lunch. You do your best all day long, and then you go sit in a room with 4 or 5 other people with your mask off and eat lunch. And it negates your efforts for the rest of the day. But that's an aside. And
Okay.
Dr. Berner, I have some questions.
Yeah, go ahead.
Dr. Berner, do you have any study that specifically cites the usefulness of mask and their efficacy?
the utility of masks at this point is not based on specific tests that show how well a mask filters and or prevents the spread from a person who's infected as a source. The effectiveness really comes from
Specifically, which study are you?
I'm saying that I don't have a specific study.
Okay, all right.
That as a nation, we're basing this
Um,
this emphasis
so-
on masks on. And
So my next question is, what percentage, what is our fatality rate in McLennan County?
we've had 120 deaths over the period, and with 8,000 cases, 9,000 cases.
And
That's
every death is terrible. I mean,
Yeah.
I hate every single one of this, but you know, when you have organizations like the WHO come out and say that the lockdowns were far more detrimental than the disease and things like that, you know, I certainly am concerned for our citizens and their well-being economically and psychologically and things like that. And I'm sure that Chief Holt knows that, understands the rise in crime and things like that that have been caused by the shutdown have, you know, certainly not made things better. So
it's you have the obvious direct effect of health on individuals and the desire to have a healthcare system that is able to take care of the number of cases we have. And from a public health standpoint, we can say these are the things we can do to try to minimize those. Looking at the big picture, yes, you have to draw a line somewhere on the level of efforts that you take, and to say that where we are now with this number of cases and the morbidity, not just deaths, but the disruption of lives there, to say that that is in fact acceptable, and that it's overbalanced by what you feel are the effects on the community in general, then that's a decision to be made.
well, we only have a very small, limited, the decisions are above us now. So
Yes.
How many, I guess, how many people are, I know I see that, you know, we're below the governor's mandate, and we've been below 15%. I'm trying to think of the question I was going to ask about, I mean, how many new, I guess the question is, do you believe that our hospital systems are have the capacity to take care of the problem right now?
Where we are right now, the number of COVID patients in the hospital as a percentage of the number of beds we have available, total use is under 15%. And I think it's going to come in around 10% or so with the new calculation method. There's nothing magic about the 15% number. But if you look
Why
at
did the governor pick that number then?
because you have to pick some number. You got to have a threshold, and where the 15 came from, I can't tell you. But I can say that
Well, wouldn't a better number be than, like, you know, how many empty beds we have? Or,
it's
you
just,
know,
it's the same thing.
um,
You know, if the number of well, I don't think that would be better, because the utilization of hospital beds goes up and down. And if we are
whether we
doing a
have
lot
COVID
of,
or not, correct?
whether you have COVID or not, that goes up and down. And so if you have a high percentage of hospitalizations due to COVID, then you've decreased your ability to take care of the others. And the higher it gets, the more likely it is that you have to stop doing elective procedures, because that fills up the hospital otherwise. Where we are right now, the hospitals are managing that nicely. And when we had a higher hospitalization rate during our higher rates with the surge, they were more stressed. And could they handle where we were on July 1st and in mid-July as a baseline? That would be very difficult. If we had stayed exactly where we are now, then that may be doable.
I had a question if Commissioner Jones doesn't have any more. Okay. Dr. Werner, when I look at that slide that you present in regards to other counties in comparison to McLennan County on the number of cases per 100,000, what comes to mind is that we're all similar, I guess, in what we're currently doing as far as socializations and openings. I'm thinking of like the recent activity amongst our school systems. And my question is, are we missing an area on which we should focus, because we're looking at what either needs to be open or closed? And I guess my question has to do with the definition of essential workers and those persons that are allowed, even though they may have been exposed to COVID-19, because they're considered, I think it's termed essential infrastructure, they are allowed to go back to work. So they're going back and they're interacting with people that are out. So when we have that dynamic, is it something not focusing on as far as how to truly mitigate community spread, instead of just solely focusing on perhaps this industry should be closed, or this activity is over here in the commercial industries? I'm wondering if there's a mitigation process that we need to refine or tweak that could perhaps bring our numbers more in line with these other counties.
And it's true that the critical infrastructure, the essential workers, you look at that population, it's a large number. But if you restrict those folks' ability to go to work even more, then you have that greater effect on society as a whole. It becomes even more restrictive. And I don't think you can go backwards there and achieve your goal of reopening. but I don't have, again, a specific mitigation effort to propose that's not already in place. We focus on those things that we can control. And so far that's been businesses and workplaces, and can only recommend to people that they limit their social interactions. But the number of cases that we see that are related to people getting together and saying, well, this event was important to us and we're going to do it anyway. That's the price you pay. And every individual makes their own decision as to how important it is to them to be out and interacting.
And I understand your answer. I guess my quandary comes, we have cases that continue to exist in our school systems, and we have schools that are having to totally close down. But then on one hand, we tell teachers and administrators that even though they've become maybe in contact with someone who's COVID positive, they're still expected to work. So I'm wondering, what is that? And I just say school for an example, because we have essential workers across industry. But I'm wondering, what does that have to do with our numbers, as opposed to, looking at us to just simply shut down an industry and a business that has been shut down since March and is really in pain. So I'm just wondering, is it something that we can look at as far as the fact that we know we're putting people back out there to come in contact with individuals, and we know that they may have been exposed to COVID-19, but we're putting them back out into the workplace anyway. Okay. Thank you, Dr. Werner.
Yeah. Those essential workers who are contacts and allowed to go back to work, the idea is that they go back to work wearing masks 100% of the time and are monitoring closely for symptoms and ideally even being tested as well. And like all the things that we're doing, each of these efforts tries to reduce the risk of transmissions occurring, but they don't prevent it. And the control of this is not going to come from any particular intervention that works so much as all of them together that individually decrease the risk, don't prevent it, but decrease the risk. Then you have, in summation, putting all those together, you've decreased the likelihood that a person who's infected is going to give it to somebody else enough that the spread slows instead of increases. And over time, that's how the epidemic comes under control. And that's what happened after the lockdown. And then we open back up and the cases left behind begin to spread to new cases. And so, I'm speaking about all of this because the question comes up about opening bars. And I'm not saying that not opening bars is going to solve our problem by any means. It's just one of the factors that will increase the risk some. And the decision that's hard to make is that significant enough to add it to the list of restrictions or keep it on the list of restrictions, looking at not just the spread in the community, but the other associated effects that come with it. And I turned that decision over to the judge.
Okay, any other questions for Dr. Werner? And I'll kind of go over, I think the next thing would be to ask, we can go back to Dr. Werner for more questions, but I want to say that the order, the protocols for bars, I think that's important. If the order comes to allow them to open, to discuss the protocols, and then the next thing would be talk about the enforcement piece, but I think maybe that would be better whenever Mike Dixon and Dustin go over an order that's prepared. And in that, it mentions enforcement, and we can ask more questions about that. But are there other questions for Dr. Werner? Dr. Werner, we really appreciate your input, and thank you so much.
You're welcome.
Thank you, sir.
Okay,
I will leave if that's right, correct?
yeah, that'd be fine. Thank you, sir.
Uh-huh.
Thank you.
If Dustin, if you would go over the protocols that the governor had put in for bars that it would change how they normally operate.
Yes, sir. There's some minimum standard health protocols that are on the opentexas.gov page that, if the order is approved, would be attached as Exhibit A. Basically, kind of stepping through those. The bars would be able to operate for in-person service up to 50% of the total listed occupancy inside the bar. All customers must be seated while eating or drinking at the bar. Bars must stop serving alcohol at 11 p.m. each day. I think that's the one big change, and that is something we were on a call with TABC last week. That's really the big enforcement piece where they are asking for help to make sure that bars would actually stop serving at 11 o'clock each day. All employees and customers must wear a face covering whenever it is not feasible to maintain 6 feet of social distance from another individual that's not in the same household except when seated at the bar. And then let's scroll down a little bit more. Customers may not loiter at the bar or in commonly trafficked areas, and they should remain seated at tables at the bar or similar establishment. Service can only be provided to seated individuals except provided below, and there are some exceptions for breweries, wineries, and distilleries. Groups must maintain at least 6 feet of distance from other groups at all times. A booth may be next to another booth as long as there is a partition in between the booths. Dance floors must be closed, and that's also for bars and nightclubs. Pathways in and out should be clear and unobstructed, and staff should be designated to ensure that customers maintain 6 foot distance if people are waiting to enter the bar or similar establishment. There should also be hand sanitizing stations set up that are available upon entry to the establishment, and there should be no tables of more than 6 people. And Judge, I believe that covers most, and there's also health protocols for the employees and contractors. And I know Mike was also working on a list of those specific protocols too. So if there's anything I missed, Mike, please feel free to share it.
Yeah, Mike, if you would, if you'll kind of go over the order that was prepared for us to look at and for me to consider. So if you would go over that and anything Dustin might have left out, but it seems that this is similar to what restaurants protocols they have currently, except for being able to do 75%, they can only do 50, and then I think closing at 11. That I'm not sure restaurants are in that same deal.
That was my question. I think restaurants are open past 11. Is that correct? And then they're just going to have bars close at 11. What's the reasoning for that?
Quit serving at 11.
Quit serving at 11. That's correct.
But they serve at restaurants after 11, correct?
That's the way I understand. Yes, sir. Based on the 51% rule, there is a difference there.
Okay, Mike.
Yeah, about the only thing. There's several different things that may have been looked over. The tables have to be 6 foot apart unless there are partitions. Which you keep talking about at the bar. Well, what they mean, they're using the bar as in place of business. Doesn't mean that people can sit at the bar. They're supposed to be seated at tables. In fact, it says don't loiter around the bar or different places like that. What the governor said is that effective tomorrow, bars are allowed to reopen at 50% capacity if the county judge opts in with the Texas Alcoholic Beverage Commission. If that county's COVID hospitalization rate is less than 15% of the bed capacity. They have set minimum health protocols that we just went over. As far as enforcement, the main enforcement is going to come through TABC in the form of suspensions, temporary suspensions of licenses. But this is an opt-in, and it can also be opted out by order just as easily if the bars cannot comply with the protocols. If at any time the hospitalizations went up over 15%, then this would become null and void. We'd have to go back to the previous situation where they were closed.
Doesn't it have to be 15% for 7 consecutive days or something like that?
No, one time 15%. And then we have to be clear, we have to be below 15 for 7 consecutive days, but just one time out kicks us back.
Because we're going to be, yesterday it says it's 14.11. So, that's pretty cool.
That's based on a calculation that is going to change. As you heard Dr. Berner say, with the new calculation, it'll be more like 10%.
Rather than using,
Well, I've heard about it changing, and it's never changed. So, that's,
as far as the stopping serving of alcohol at 11 p.m., that doesn't mean the bar closes down. They can continue to serve any kind of foods or whatever they want to do there, but they can't serve alcohol. And the issue there is that after that period is when you start getting the sloppy drunks. They're hanging all over each other and stuff. I think that's probably what's meant to be avoided. The bars, they have a vested interest in making sure that the health protocols are followed by their patrons. If they're not, and they're caught and warned and go back out and they're still doing it, then they're going to end up getting a temporary suspension of the license, or the whole thing's going to go down. As far as we may opt out if we're go to 3 or 4 bars and they're all not complying, it's just not working. We have other enforcement authorities that could be injunctive relief or things like that, but the more realistic authority will be reporting to TABC and letting them handle it. And hopefully, after you give a warning, people start complying. It makes sense that they would, if they're hungry enough to be back open, that they should want to do whatever they can to stay open.
Well, Mike, do you know how many bars there are that are left open since they've been closed so long? I think the majority of bars have converted to restaurants and there's no just single bars left. Do you know of any?
I have no idea. I think that there's some that have maybe converted, but there's still a lot that are on the 51% list.
I agree with Commissioner Snell. I think that if any of the bars that have, intended to stay in business and try to make it through this shutdown have changed their license, and if they didn't, then they've gone out of business. And I know of ones that have gone out of business.
I know of several.
There's, according to city manager at Belmead, he thought there was 5 or 6 that did not convert, that actually shut down. So don't know whether they would reopen or what, but I don't know the rest. We were referred, we asked that question to TABC and we could not get I think we were pretty much told to go calculate it ourselves, and it was a pretty daunting task. And so we haven't done that. But I agree that there a good many of them had modified their license to be able to serve food. And
Well, then it may not be as important. This particular order may not be as important if most of them have gone that way. And given what Dr. Berner said.
No, I think it's important. I think that we have to show support for opening up businesses and getting our county and our country back going again.
Yeah, I mean, I agree with Mr. Jones. I mean, I don't think the government should pick winners and losers in any business, and that's effectively what they've done. And there's no proof that the bars were causing a problem to start with. They said they were going to close them in March till the numbers came down. Well, the numbers never came down, and they were closed and the numbers kept going up. So I don't see a reason to continue to keep them down. I do not agree with the deal of they have to have 11 o'clock shutdown, because most bars don't really get started until 9 or 10, and then they go till 2. So I don't agree with that at all, but I think anything we can do to help the bars that are out there, we need to do. Unless the state and the county is gonna, do something, because, they've been shut down since March, or they've been forced to change their business up totally. But at the end of the year, they're still expected to pay their same amount of taxes, even though their buildings have been basically empty most of the year.
Didn't we preclude restaurants and bars from the local assistance?
Yes.
I think they precluded bars, not restaurants. Anything that limits patronage to 21 and under did not get any assistance.
Okay.
The
And
bars-
when do the restaurants have to close and stop
As far as
serving?
I know, they don't close till 1 o'clock. And don't start, I mean, I think you can still buy alcohol in restaurants up till 1 o'clock.
But I don't think we can change that piece. That's the governor's piece right
Right.
there.
Yeah, right.
This is an opt-in option that is created by the governor. So whatever we do, we have to stay within those guidelines.
Yeah.
So it is, but
I'd like to hear
it
that.
is what it is.
Right. Okay, other opinions?
And I'd like to say, I mean, yeah, I would support, going to the opening of the bars. There's some bars here in town that start serving at 7 in the morning for our people that work at night. So that 11 o'clock at night, it's not going to affect them near as bad. And I know some of those have been closed.
Mr. Miller, do you have a thought?
I'm inclined to side with the opting in and going with the minimum standard protocols for bars. I understand Dr. Werner's reservations, especially given the positive case numbers, but there's nothing that shows that opening the bars or closing the bars would do anything to change what we're currently experiencing. And I just think it's an industry that's been hurt for quite a while, especially given the fact that you have the opportunity, or the court has the opportunity, to always come back and revisit this.
You know, the frustrating part, I think, for all of us is that we're still guessing. We're 8 months into this, and we're truly still guessing, trying to figure out what's the right move. The city and the county have been very aggressive in making changes when the numbers were scary high. But here we are, and we're still having a problem. So I think it's really truly coming around, we're having to learn to pick and choose as individuals where we go, what we do. But to exclude someone from being able to make a living, I think we're past that point. We have to be more respectful of whether I go to bars or not. There are people that make their living that way. And if they're willing to go by the rules and regulations that the governor set out, and I can't in good conscience tell them that they can't open.
Okay, any other thoughts?
Well, Judge, I tend to agree with that as far as if they follow the protocols, but there is a reason for on the bars, because normally it's a compressed area. People are right up against each other. And, you know, once people start drinking, they lose a little bit of inhibitions and maybe aren't keeping that social distancing. But if they follow these protocols, then there shouldn't be an issue.
Agree.
Okay. If nothing else, we will go to item E3, discussion or action on BKD proposal.
Well, Judge, actually on that order, the way, unless you want to change it, I had an approval from the Commissioner's Court of your order just for, but if you want to change that off and just make it your order.
I do.
Okay.
Okay, under item E2, discussion or action, potential action, excuse me, I'm sorry. This is action on a proposal from BKD. Dustin?
Yes, sir. As we mentioned, a previous court session, BKD has helped the city of Waco and others kind of navigate the CARES Act funding and the reimbursement. We have on the call Julie Murdoch and David Coleman from BKD. They've put together a proposal that they sent to us last night. TDM has sped up some of the deadlines for reimbursement and some additional requirements. So with that, I'd like to turn it over to Julie and David and kind of discuss their proposal, and then the court can discuss after that, if that's okay.
All right. Well, this is David Coleman. Good morning, everyone. Good to see you all. I wanted to first tell you a little bit about BKD. So we are one of the largest CPA firms in the country. I'm based here in Dallas. Julie is based here in Dallas. We have offices in Dallas, Fort Worth, Waco, San Antonio, Austin, Houston. And so the public sector is one of our big sectors. It's one of our big sectors. And so what that means is we have folks that are dedicated to doing audit and consulting services in the public sector. So we spend our entire professional careers in this sector. I'm going to let Julie introduce herself real quick, and then I'll give a brief overview, and then she can talk about the details.
Hi, good morning, everybody. My name is Julie Murdoch. I'm the director here for the Dallas, Fort Worth, and Waco practice related to grants management. And so, as David mentioned, we have been involved with a lot of different organizations, helping them with the CARES Act funding. And then just my background, I spent about 10 years in for-profit, then also about 20 years in the kind of not-for-profit government grants management. So I've got about 20 years of experience, and looking forward to talking with you all today about how we can help.
All right, excellent. And again, my name is David Coleman. I am a partner of our Dallas office, public sector practice. I practice all over the country, clients from airports to counties to cities. I specialize in audit and consulting services for these clients. So I kind of wanted to give you a brief kind of overview of the CARES Act and what you all will be facing. And then we'll let Julie talk about the nuts and bolts. But since you receive CARES Act funding at a very high level, that's going to be subject to a single audit. So at year end, your auditors are going to come in and say, did you spend this appropriately? So let's just say you spent $2.5 million, audit that. So whenever you receive federal dollars, money from the federal government, there's always strings attached. There's significant regulation and significant requirements that you have to follow in order to spend that appropriately. And, ever since March and April, when this thing happened, and then it was determined that the CARES Act was going to be distributed to our governments, some of our governments receive hundreds of millions of dollars every year and are very well adapt to spending that money appropriately. They know the rules, they have people, they have systems in place to spend that money appropriately. Well, a lot of our clients do not. They do not have the personnel in place. They do not have the structure, the infrastructure, really the know-how or the knowledge to spend that money appropriately. So that's kind of where we come in. We stay on top of the rules, and then we come in and once we get kind of a philosophy from the court, then we go to work helping the city or helping the county spend the money in accordance with rules and make sure that it gets to where you all want it to get. So that's kind of a high level of what we do. I'll let Julie add to that as far as anything that she'd like to add, and then we'll take on questions.
Sure. So thank you, David. Just to let you know, like on page 2 of the proposal, you'll see some of the projects that I specifically am working on. Sedgwick County, Kansas, also as Judge Felton mentioned, the city of Waco, and then Cole County, Missouri, which is where Jefferson City is located. And so with that, we've really seen a lot of different ways to approach this. One of the nice things about BKD is we can kind of tailor our approach to what you need. In our proposal, we have kind of done, I'll call it just the basic plan of helping with the TDM requirements, which are more restrictive than most of the states in the country, where they're requiring a lot more data entry, a lot more documentation, and kind of time is of the essence because they have speeded up their requirements in terms of showing how the money will be spent. So reviewing those expenditures, making sure they're compliant, getting them into the portal, tying them back on anything that you've currently spent. That would be the review and the reporting mechanisms. Also being able to answer any questions they might have on, did you allow this? Just kind of any questions they would have. Also, we can look at some of the counties do an application process. So if you were to determine that you did want to distribute this money to small business, it could be nonprofits, it could be other municipalities, it could be schools, it could be whatever you decide, then we actually have an application process that we help you stand up, and we review those applications, we present to those or to you all the applications that are compliant so that you can then make the decision on what you want to fund. We notify those recipients. We have subrecipient agreements set aside with them so that we can monitor them, which is your requirement under TDM guidance and as well as the federal guidance. So all of that to say, we can kind of go a lot of different ways based on what you feel like you want to do. And even if it's something that right now you're not sure, again, we kind of help you walk through that process, the funding methodology, how much, you know, you want to spend on different entities if you want to go that route. So with that, I'm going to kind of skip on down to in the proposal, the actual, and I believe it is on page 6 in the proposal. So we've given kind of two options. One, as I mentioned, would just be without that distribution and subrecipient monitoring. The planning and development, the review of the expenditures, and then the ongoing technical support and closeout, because you will have, even though once you've spent the funds, there'll be some additional reporting requirements that we'll have probably through the first quarter of 2021, unless obviously it is extended either by the federal, probably by the federal government. So with that, you can see we're estimating about 364 hours. And that's at a rate of between $230 and $250 an hour. So if we were to move forward into option 2, that is a total of 565. It's not in addition to, it's a total. So if you can kind of see the incremental hours between 565, about 200 hours extra. And again, that rate would be between $230 to $250 an hour. There are some costs related to the application portal that we would set up. But again, that tracks all of your cost. It helps with all of the reporting. We'll be able to provide all of the reports to you, whether it's on a weekly basis. And typically right now, given the nature of how quickly things are moving, we've actually been working with commissioners courts on a weekly basis to kind of help get the money out if that's the direction that you choose. So with that, it kind of gives you an overall feel for the costs involved. Those are going to be covered under the CARES Act CRF funding. And then I believe the only other thing that I just wanted to touch on, which is the slide 8, and this may sound somewhat trite, but you know, unmatched client service that's really why I'm at BKD. That's it's not just about the slogan, as they say, but it really is something we live and breathe. And you know, hopefully, if you talk with Waco or any of these other organizations, you'll know we're committed to you guys, whatever it happens to be that you need. We want, you know, you to be able to serve your community in the best manner possible. And so that's, you know, it's not only, it's my personal commitment, it's, you know, and obviously it's the commitment of BKD. So I just wanted to close with that and open it up with any questions you might have.
I'm going to ask one right quick, and it may be a silly question, but is there any area under the CARES Act that your fees are reimbursable?
Yes, yes, they are.
So I mean, I thought I heard you say that your fees are reimbursable. Is that correct?
Yes. So those fees
Hard
are.
to ask the same question.
Yes, they are reimbursable under the CARES Act.
Yeah, and I just want to add something to the fee table. I just want to make sure all the commissioners understand the differences between option 1 and option 2. So I don't know if you have that in front of you. So option 1 would be for you to spend that money in-house. So you spend all of your grant funds at the county level, whether it be people safety or whatever. So you're still going to have significant requirements for that, but let's just say that the court says, okay, we're going to give half of it away to our schools or each municipality. So when you bring other outside folks in that, you're going to be responsible for monitoring those entities to make sure that they spend it right. So that's the difference between those fees. So there's a lot more work that we have to do and you all have to do if you say, okay, I'm going to give this money to the school district. So there's continuing compliance requirements. So you have to monitor that they get audited, that they're spending their money appropriately. So a lot of folks get kind of confused with that. I just wanted to make sure that you all understood that.
And there is one thing that is changed with some updated guidance in the Treasury Department, and either David or Julie or Francis can kind of add in, but early on it looked like a lot of our public safety expenses would not fit into that 75% category, but there's been updated guidance now from the Treasury Department, which says there is a presumption that those public health and public safety expenses, which would include sheriffs and sheriff's deputies, are reimbursable under that 75%. David, Julie, is that correct?
Yeah, that's exactly right. And that's one of the things that we're seeing is taking advantage of that presumption, because what that does obviously is then frees up other general funds for the county if they need to spend the money, in any manner that they deem necessary. So, we're working with different constituencies to be sure we've got the right language, but the guidance has been clarified to allow that presumption.
And I think that since that's been cleared up, it appears that we do have enough expenditures currently to eat up all of that grant funding. But it would, of course, be up to the court if you wanted to do that, or if there were other programs that you wanted to pursue.
And we can make those decisions as we move along through if we go into this contract, we can have discussions and then decide what are our priorities.
Would we have to, can we just act to engage them today, or do we have to pick an option today?
You do not have to pick an option on our end. So we're very flexible on that. And, that's just kind of an estimate. And so, if you come back and we have to do significantly less work, then we can go to work on that fee. And so it's just, we kind of threw that together from last week. Knowing that you all were having a meeting today, we wanted to get something to consider. So.
And David's right in that, if we don't incur any of these, it's not that we want to incur any costs, but if we don't incur those number of hours, then obviously you won't be charged for that. So it is just based on the time that we expend.
Any other questions from the court?
And Judge, if we do choose to move forward with this, TDM is requiring pre-approval of these types of consulting agreements. I went ahead and forwarded it down to TDM for their review this morning, but we would suggest just making the motion for the approval contingent on receiving that approval from TDM. And then there's also a second part that really needs to happen first is we could have a motion that the consulting agreement with BKD be exempted from competitive bidding pursuant to section 262.024A4 of the Texas Local Government Code as a professional service, including auditing and legal compliance assistance and review.
I make a motion that we do that.
Is there a second?
I would second.
Motion been made and second. Any other discussion?
I just have one question. Depending on the option we choose, still on top of that, there's the additional 25,000, then the additional travel costs and an additional administrative fee of 4%.
Right. So the 4% is an administrative cost, kind of regardless. The fee for the technology would be if we decide to move forward with an application portal, because it's actually, the programmer set up the portal, the reporting package, the method that people will submit the receipts, all of those things kind of go along with that. So in the event that you don't choose to go forward with an application process and providing money to recipients, there would not be a charge of the 25,000.
Okay.
Okay, any other questions or comments?
And I guess we can decide if we needed to have individual applicants later on.
Yes,
Yeah.
absolutely.
Everything's flexible on here. This is not our actual engagement letter. This is kind of worst case scenario, if you will. So, we'll do an official engagement letter and lay all this out in a contract. But this is just kind of our proposal, what we're thinking.
All right, thank you.
Any other questions? Okay, we have a motion and a second. No other question, we'll call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. And Dustin, we probably want to have this as a every commissioner court meeting update on it. So it needs to be in the work session unless there's an action item, and then we'll have it in the action side of it.
Sounds good.
Okay. Is there anything else to come before the court today?
So we're not going to approve the opt-in, or just you?
I've left it for my decision, but your input was important and I appreciate it.
Okay.
To have something out here pretty quick. Okay. Any other questions, comments? If not, we stand adjourned.
Thank you all.
Thanks, everybody.
That's a really
I phoned off.
That's a good idea. Because we did it.